coming up on the Doctor's Hospital podcast.
So we offer preventative care practically free under our LAMP primary plan and also under our LAMP ultimate plan.
It's no deductible, no pre-screening, no approvals, anything. You can just come and sign up.
So this is an upgrade from the LAMP primary program.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Hello, everyone. I am your host, Eddie Russell, the Learning and Development Specialist within the GLOW Initiatives Office, our hospital's organizational wellness solution. And welcome to the Doctors Hospital podcast, where we connect public health issues to what we do in the Doctors Hospital healthcare system. So today we're here to talk about the Loyalty Advantage membership program that is instituted and created by Doctors Hospital. And today we have in studio two very special ladies who are here to talk to us about this particular plan. We have Laniqua Sands, who is the membership and collections officer, and we also have Mercedes Martin, who is the client services and reconciliations officer at Doctors Hospital. And these ladies are the ladies that manage, basically, these are the go-to ladies who manage the Loyalty Advantage membership program here at Doctors Hospital. What's interesting about this particular program and this session that we're going to have today is we're going to be talking about LAMP Ultimate. So this is an upgrade from the LAMP primary program that we recently had. So I'm really excited to hear about what we have new and exciting with this particular program. So I want to jump in with the questions because I know that people listening here are listening to this program are going to want to hear exactly what this program is. So, Mercedes, I want to send these questions to you first, and I want you to just tell us what is LAMP Ultimate, and how does it aim to make healthcare more affordable and accessible to the community, and even to us who are within the Doctors Hospital healthcare system?
Good day, Eddie. So glad to be here. LAMP Ultimate is our upgraded plan. So we have had LAMP Primary running for a while now, and we have had great success, and people utilize that program. They depend on it. And we have recently decided, based on utilization, based on the needs of our community, that we should offer something more to individuals. So we decided to bridge the gap between our insured patients and uninsured patients. So with the LAMP Ultimate plan now, we have the core benefit of the prime care, and we have added urgent care, more imaging benefits, pharmacy, labs, discounts on outpatient rehab, and discounts on ER and inpatient. So that's the gist of the upgraded plan.
I don't even know what the planned components are, but I could already tell this upgrade, because we know at Doctors Hospital we do it big.
Yeah, we giving away things. We giving them away. We giving them away.
So tell me what are some of the medical services that are included under the plan's core benefits?
Okay, so first of all, we have prime care visits. That is your preventative care. So it's unlimited in office and telehealth consultations. So you can go into any of our outpatient prime care locations and you can see your prime care physician as many times a year as you would like. And then we have urgent care visits. So urgent care, a lot of people don't really know, like, what is urgent care? That is anything that is a spontaneous illness or injury that comes out of nowhere, and you need immediate attention. But it's not as severe as to go into the ER. So anything you would go to your average walk-in clinic for, that is urgent care. So we have DH West, which is on Blake Road, and then we have Paradise Island, which just recently opened up.
Beautiful facility. By the way.
Yes, it's wonderful. So we have two options for those services. And then we go into the preventative care, which is your one annual physical per year with labs included. And then we have laboratory services. We have a list of labs. It's about 50 to 100 labs. And every lab on that list is free, unlimited. So anytime a year you go to your prime care physician and they order a different lab test, once it's on that list, it's free. It's covered. So you go for a prime care physician 10 times a year. Once they order something on that list, you get it free.
That is major.
It is. It is.
That is major.
So anything outside of that included laboratory list would be 30% discounted. So we do have some special lab tests that can get extreme, but those are discounted at 30%. Okay. And then after that, we do offer imaging. So, we know imaging can be expensive, MRI, CT scan. So we have 2 free MRI or CT scans per calendar year. And then after that, it's a 30% discount if you would need additional MRI or CT. But we do have unlimited X-ray and ultrasounds for the year. So you don't stop with those. And then we have a pharmacy benefit. People love medication. The doctor love to prescribe medication. So we have a list we filtered a list. I think it's like almost 150 medications that are $25. Anything on that list, $25 plus VAT. So
That's insane.
yeah. And then anything outside of the list would be discounted at 30%.
So
Yeah.
we're really making healthcare really affordable.
Yeah, really.
Yeah.
And I think even when we get into, because as I looked at the
Mhm.
brochure and I'm looking at the different services and the different price points, which
Mhm.
we're going to talk about a little bit later, I can see that we're making it very flexible as well.
Mhm.
I know that. So this is ultimate. So obviously there was something before this.
Mhm.
Right.
Tell me how. And we heard about all of the benefits. What are the upgraded benefits? Are those the upgraded benefits that you just went through?
Yes, so correct.
Okay.
Everything that I just described, outside of the prime care benefit,
Mm-hmm.
is the upgrade. So the urgent care, the upgraded lab listing, the upgraded imaging, and the pharmacy.
Mhm.
Those are the main upgrades. So our primary care plan is the primary care.
Mm-hmm.
And then you get discounts on outpatient rehab. You get 2 nutritional consults, and then you get your emergency room benefit, as well as your 20% off on surgical day case and facility fees if you were to be admitted. So those are the base benefits of the prime care and the ultimate. They share those benefits.
Oh, I love
Yeah.
it. Listen, this
Mhm.
plan is
Yeah,
for,
it
for
is.
people. Listen, so like for instance, if there is somebody who does not have health insurance, how does LAMP compare to traditional insurance in terms of coverage and costs? Because like we talked about the different costs that you would incur if you enroll into the plan, which I encourage everybody to do because these benefits are insane. How do we compare to traditional insurance in terms of coverage and costs?
Okay, so it's not a comprehensive insurance plan, and we know this. But however, like a lot of people are currently uninsured and they do need some form of coverage.
Mhm.
So LAMP plan is there, like I said, to bridge that gap, to
Right.
give you something to lean on in the event. It's no deductible, no pre-screening, no approvals, anything. You can just come and sign up, as Laniqua will talk about later on. But it's compared to, it's no hassle. It's no, you don't have to go through that process of what's approved, what's not covered, what's denied. You know your benefits. We give you your schedule of benefits. You know your benefits. Those are your benefits, and we'll honor them every time you come in to any DH location for service.
I think we doing our part.
Yeah.
I think we're
Yeah.
doing our part.
Yeah.
And I know people often talk about health. Healthcare is a very expensive thing.
It is.
It's
It
very
is.
expensive.
Mhm.
And I think any initiative to kind of mitigate the cost of it
Yeah.
in some way, shape, or form, because it's not going to be in totality.
No.
Even with insurance.
Mm-hmm.
We have to. I'm really glad that we're taking this step forward and making it affordable for these type of services as well. Laniqua, I want to talk to you now because, like Mercedes said, there's no prerequisites or no prerequisite signing. There's nothing that you have to do to be a part of the program. So tell us about who's eligible for the LAMP Ultimate Plan and what steps do potential members need to take in order to enroll in the plan?
Hello, hello. So, like Mercedes would have mentioned, there are no pre-screenings that are required. There are no age gaps because we do get that question a lot. Not age gaps. There are no age stipulations. Sorry, on whether or not persons would be able to join the plan.
Mm-hmm.
So, pretty much anybody is eligible.
Right.
There are no conditions that apply for eligibility. Anybody who's interested, you can just reach out to us and we can have you enrolled. So usually the steps would require you to, if it's online enrollment,
Mm-hmm.
you would need to visit the website. It's www.doctorshosp.com/lamp. So you would visit the website and you would fill out the jot form, and we would reach out to you once we receive that submission. If you're signing up in person, you can visit any of the outpatient clinics and you can fill out the form. And once we receive that information, you will be contacted. So enrollment is a pretty easy process. We can be contacted at 822-1009 or 302-4635.
I like that we is making it easy. It's easy to enroll and it's also
Yes.
easy. It seems easy to afford as well,
Yeah.
right?
Yeah, it's very
Mhm.
affordable.
And I know that so we're upgrading from Line Prime, the primary plan. But tell us, I know people have a lot of questions because this deal sounds like it's way too good to be true.
Yeah.
Except it is. So what common questions do you typically get? Just like frequently asked questions, so people listening can kind of do their own assessment. Just quickly listening to this podcast.
Right. So persons usually ask, well, I guess one of the questions the persons usually ask would be if the plan has group plans, if we have family plans. So we are excited to announce that we do have group plans and family plans at a discounted rate.
Mm.
So if your whole family is interested in signing up, you can let us know. If you're an employer and you have a group of employees that need coverage or you want a more affordable coverage, you can let us know and we can facilitate that as well. But those would be the burning questions that persons would be asking. And then obviously the question where if their parents would be too old or if a child is too young to join, anybody can join, anybody can enroll. We don't turn anybody away. So if you're interested, you need the coverage, definitely let us know. We welcome everybody.
So what resources are available to members during the enrollment process? And how can they get that assistance?
So usually when you inquire about the services, we would send supplemental information. So things like a schedule of benefits for the plan that you're interested in, as well as a brochure, or any information regarding, for example, for our LAMP Ultimate Plan, we've been sending out the list of prescription medication that would be covered, well, that would be capped, sorry, at the $25 rate, as well as the list of labs that would be covered at 100%. So things like that, we send out to person so they know exactly what's going to be covered. And the schedule of benefits also serves as kind of like a contract.
Mhm.
So once you present that, or once you let us know, okay, well, this is LAMP Ultimate, this is what I come for, we honor that. So all of that is sent out prior to you making your initial payment.
All right. Ladies and gentlemen, we are in studio today with the ladies of LAMP. We have Laniqua Sands, and we also have Mercedes Martin, who are going to talk to us about this LAMP Ultimate Plan that Doctors Hospital Health System has created for just to serve the community. But we're going to take a quick break, and then we'll be right back.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.
Welcome back to the Doctors Hospital podcast, and we are in studio today with Laniqua Sands and Mercedes Martin, the ladies of LAMP. I'm always going to give them these words.
The LAMP ladies.
The LAMP ladies. I'm going to give, that's your child. That's who I'm going to call. That's what I'm going to call y'all when I see y'all again. The ladies of LAMP, the LAMP ladies. Today we're talking about the Loyalty Advantage membership program. Ultimate, by the way, because we've upgraded. And we're talking about the features of the LAMP program right now. Mercedes, I want to ask you, could you break down the conditions that apply for services such as urgent care, imaging, preventative care, all that stuff?
So for, like I touched on a bit earlier, so for urgent care, once a member comes in, they have 6 urgent care visits covered on the LAMP. If they should need a 7th, and we hope they won't, they would have to cover that visit entirely. So that won't be covered, no additional discounts or anything for that visit. It'll be a self-paid visit.
Okay.
In going into our laboratory services, we have, like I said, we have a list of labs that will be covered 100%.
Okay.
If it's not on that list, then those labs will be discounted at 30%. So say your doctor orders 6 labs, 4 of them are on the list, they would be free. The 2 that are not on the list, you would have to just pay at the discounted 30% rate.
Okay.
Yeah. So that's the lab limitation. And once they are referred by a doctor's hospital physician. So we do encourage to keep everything in network. We encourage our lab members to have a prime care physician here at doctor's hospital. So you maintain all of your full discounts once you see one of our prime care physicians. Now, if you have an external physician that you've just been going to for 10, 20 years, behaviors go, in that case, then you would just get a 30% discount on the covered unlimited labs. You would just get 30% discount. You won't get the full 100%.
So it's best to be in the family.
Yeah, stay in the family. Let's keep it in the
family.
family. Yeah, let's keep it in the family.
But the good thing is you don't pay full price for anything, regardless of if you stay within the network or not.
Yes.
You still receive it at a 30% discount, which I think is better than nothing.
Yeah, I mean, a discount is a discount is a discount.
Yeah. Really? Something's better than nothing. Something's better than nothing. $1 saved is $1 earned.
Yes. Okay.
So, so we'll go into the imaging. Like I said, it's unlimited x-rays and ultrasound. Unlimited. If you need 10 a year, we got you. So the limit comes in imaging, MRI and CT scan. You get 2 of those, either or if you use 2 MRI or 2 CT, beyond the 2, you would have to get discounted at 30%.
I wish I had lump when I needed some imaging done a couple of years ago.
Yeah.
I wouldn't have to pay.
No, exactly.
I was going to the States, but I'm glad we can really keep it in the family here now.
Yes.
Yeah, and then we have the pharmacy discounts where we have the pharmaceutical list, which is $25. Anything on that list, anything outside of that list is 30% discount. Okay. And now that prescription can come from any doctor. Okay. We don't discriminate with that, Our pharmacy is, more like a open to the public type of thing.
Yes.
And then we have the outpatient rehab, which is 20%, nutritional consults, 3 per year. After, if you need a 4th one, you'd have to pay for that one full price, self-pay price. Emergency room. This is a great benefit because we actually had someone today utilizing LAMP Ultimate, and they had to go into the emergency room, and they gave us a call and they said, okay, just to confirm the benefit. And instead of paying the $3,000, they were only needed to pay $500 plus VAT. Versus $3,000 up front.
Could we repeat that?
Yeah, let's make that clear.
So,
because I think when you think about Doctors Hospital, you want to get the best care that the country can provide. And as a JCI accredited hospital, there are standards in place. So we can't drop the ball, right? But repeat what you just said.
Oh. Got this great little benefit, right? Be a hospital first. A hospital first. So sometimes people got to come in the hospital,
right,
and into the emergency room. So we have, instead of the average $3,000 self-pay cost to even be looked at, triaged in our emergency room, you pay $500 plus VAT once you're a LAMP member. I mean, come on, you can't beat that. Now, that's the initial payment, and then everything else will be back billed. So after your visit, then we'll send you, our credit and collections team will send you your final bill.
Yeah. I think,
and you can arrange a payment agreement. You can pay as you go. But yeah, it's like, you'll be seeing $500 plus VAT. Come on.
I think that solves that 3 o'clock in the morning emergency.
Yes,
Yeah.
exactly.
And
Like,
expeditiously.
because who
And-
have $3,000 lying around,
Yeah.
really
Listen.
just there to say,
I mean, I could get it.
You could, yeah, but who want to get it, right?
Not at 3 o'clock in the
Come
morning.
on, exactly,
Right.
exactly,
That's
exactly.
I think that's stellar. Laniqua, how does the program support individuals managing chronic conditions? Now, we recently saw in the newspaper yesterday, I think it is, the managing director of the Public Hospitals Authority, Robinette Rose, said the population is very sick. And she also spoke to how comorbidities within widespread throughout the country is the reason. So can we speak to how individuals managing chronic conditions or seeking preventative care, how this program supports them?
Well, I think this program definitely supports those that are managing existing conditions, as well as those who want to be intentional about preventative care, because we do offer those benefits within the plan.
Right.
So we offer preventative care practically free under our LAMP primary plan and also under our LAMP ultimate plan. So you get your routine visits every year covered at 100%. You get your primary care visits unlimited with the physician consultation. So there's really no reason for you not to know what's going on with your body. So even if you have pre-existing illnesses, you can sit with your physician and talk about these things, how you can be treated, things like that. Even though LAMP doesn't facilitate specialist visits, your primary care physician can guide you in the right way and even in the right direction, And even with urgent care, let's just say those who have chronic conditions that require immediate attention,
Right.
that's facilitated under LAMP Ultimate as well. So we definitely support those that have pre-existing illnesses as well as those that don't, and those that want to be intentional, like I mentioned, about preventative care, because we do have those benefits either free or at a discounted rate or at an affordable rate under LAMP Ultimate and LAMP Primary.
All right. So Mercedes, I gotta touch on you again because I heard about the benefits, and I think we need to just reiterate some of the benefits. So what discounts or additional benefits do members receive from services like outpatient rehab, nutritional consultations, and day surgeries, that sort of thing?
Okay, so those because it's focused more at outpatient services, keeping people out of the hospital. That's the main goal of the program. So we have outpatient rehab discounted at 20% per session, and we have occupational therapy, physical therapy, as well as speech therapy, which is very major. Now a lot of kids have autism and different speech delays, so a lot of people utilize that service, as I've seen working in that space previously. We also have nutritional consult at 3 per calendar year. And for our LAMP primary plan, we have 2 per calendar year. So we upgraded one more for our LAMP Ultimate members. And then we have the surgical day case in the event that you need to come in for a procedure to utilize our facility.
Right.
In hospital, we give you a 20% discount on our facility fees. Also, if you would need to happen to come into the ER now, you would need to be admitted. Although the plan does not cover, your physician fees as well as cover the visit, we give you a 20% discount on our facility fees. So what doctors can control is that discount on our fees, our facility fees. So we offer that to our patients for now, So those are tremendous. Like I said, in the ER discount, the ER benefit of the $500 plus VAT to enter, they are really top tier benefits.
I have a question because I feel like this might happen to me, God forbid. If I have an emergency and I come to ER and I am not within the plan, and one of the intake people who register
Associates,
the registration associates, one of them, they mentioned the plan. Am I able to sign up for that plan then and there and then get the discount, or do I have to do that
prior?
before?
So we want to encourage people to not just sign up when you need it.
Because you need it right then.
Yeah, like
Mhm.
because people just sign up.
Yeah.
This benefit, I need this right now. Let me just sign up to get the free services and the discounts. So we have a 30-day wait period.
Okay.
So if you were to sign up December 1st, you
Mhm.
won't be able to use your benefits until January 1st.
Okay, so let's repeat that because I think this needs to be repeated and
Yeah.
this is very important. If you are
Yes.
listening to the sound of my voice,
Yeah.
you have signed up for the plan and in 30 days you will
30.
be using it.
Yes.
You'll be
Yeah.
able to use it.
Yes.
And so I think this is really important for
Mhm.
people to understand because we're going into the holiday season
Uh-huh.
and there's a lot of stress that happens during the holiday
Yes.
season.
Yeah.
For whatever reason, it's a hype up time.
Yes. Yeah.
It's very hype up. A lot of times, during the holiday season, people have strokes and they have all of these
Pressure.
very
Yeah.
things
High blood
because,
pressure, diabetes, all of that stuff.
and it's really
Spikes.
just because they want to have a good vibe.
Yeah.
Yeah.
Yeah. Everyone
Yeah.
want to have a good time.
Everybody want to have a good time,
Yeah,
and
it's a jolly
sometimes the
time.
pressure of that
Uh-huh.
can send
It
you
can
to the
impact your
emergency
Yes.
health.
room.
Yeah.
Yeah.
it can.
So right now, if you do it now,
Mhm. Yeah, if you sign up
You
now.
sign right now.
Yeah, and for the month of November, we actually have the wait period waived.
Waived, yeah.
Yeah,
So we
and
still
it-
have a couple days left
Yeah.
to sign up.
Yeah, you sign up for the month of November, the wait period is waived.
I don't know what else we could do.
Yeah.
What else can we give you?
We have a promotion going on as well. Laniqua, you could mention the three months.
Yeah,
Oh,
so for
please.
persons for the first 1,000 persons that sign up, you get a 25% discount off of each month for 3 months. So the plan, which we will talk about pricing, but the plan is currently priced at $119 plus VAT. If you sign up now, you would get the plan for about $98 per month for 3 months. So you save around I want to say almost $100 on the plan. So definitely sign up.
No, I signing up now. I'm signing up now. So I know that we talked about all of the benefits now, and like you said, it's this particular plan is not comprehensive, so it doesn't cover everything. Niqua, are you able to tell us what are the exclusions and limitations in the plan
Right.
that potential members need to be aware of? Because we said all of the benefits that they get, but we also want to make balance the information and
What
let
is
them know
not
that
covered,
what is
yeah.
not covered under the Loyalty Advantage membership program Ultimate.
Right. So LAMP does not facilitate specialist fees. So I know we would have gotten inquiries regarding maternity, cardiologists, things like that. LAMP does not, at this current time, does not facilitate specialist fees. We also do not cover inpatient admissions. We do provide, like Mercedes would have mentioned, a 20% discount off of facility fees, but any physician fees or anything like that, we do not facilitate. We do not cover the ER bill. We just provide a reduced upfront emergency room deposit, which would have been the $500 plus VAT, and then the subsequent back billing via payment authorization. So those would be the exclusions. We don't cover surgeries. We don't cover procedures that would be happening in an inpatient space, meaning you being admitted into the hospital. But we do provide small discounts here and there to facilitate some of the cost.
I love how this program is set up to be your just in case plan.
Yeah.
This is your man and old.
Yeah. Yeah. Yeah, we
Yeah.
filling in that gap.
Yeah, I
Yeah,
love that. I
yeah.
love that. It really is filling in the gap. Where can members access LAMP services, and are there any specific facilities or locations included in the network? I know Doctors Hospital has been expanding.
Yeah.
Tell us about the different areas and the specific facilities and locations.
Yeah, so at this current time, because Doctors Hospital is intentional about expanding to reach all islands, LAMP can be used at pretty much any Doctors Hospital facility. So clinics like the Centerville Medical Center, Dalton Medical Center, Carmichael Medical Center are our 3 main primary care facilities. Then our urgent care facilities would be the recently opened Paradise Island Medical Center. We have the Doctors Hospital West, located on Blake Road. In Freeport, we have the Cavallo Medical Center, Freeport Medical Center, and Exuma. We have Exuma Medical Center. Each of these facilities facilitate LAMP. We also have our laboratories housed at our main location, as well as the Meldon Plaza, where a pharmacy is also located. We have a pharmacy as well as in our main hospital and the Point. So we have a lot of different facilities. Then for rehab, we have our Cable Beach location. located in the Cable Beach Plaza.
Yep,
Yeah.
it's right next
And-
to Wendy's.
Yeah. Next to
right
Wendy's.
right next to Wendy's. And then we also have the rehab facility that is Collins Avenue. And then, imaging can happen either at the main hospital or at DH West, but DH West does have limited imaging services. So the
Mhm.
main hospital would be preferred. But you can use LAMP pretty much at any doctor's hospital facility in Nassau or Freeport and Exuma.
So we have a couple more questions, and I wanted to talk about. So we've heard about, or it's been alluded to, all of the discounts and how much money
Right.
you save. So I want to talk about how does the pricing structure work for families and groups, and what discounts are available once, say, a group of maybe 5
Mhm.
or more are meant to participate in this particular plan.
You're right. So I guess I can start to talk about the family plans first.
Yes.
So for persons, if it's just a member only, it'll be the $119 plus VAT. If it's a member and a spouse, it's $225 plus VAT. If it's a single mother and her child, it's $160 plus VAT. And any additional children, meaning that they're under the age of 18, they can be added on for $45 each.
Mm.
So you receive a pretty good discount for family plans.
Mhm.
And then for businesses, the discount depends solely on how many employees you have. So
Mhm.
if you have 5 to 10 employees, instead of paying the $119 plus VAT per employee, you get a 5% discount and you pay $113 plus VAT.
Mhm.
If it's 11 to 25, you receive a 10% discount. So that's around $107 plus VAT. 26 to 50 employees, you receive a 15% discount. So you pay a little over $100, which is around $101. 51 to 100 employees, you get a 20% discount. So you end up paying a little under $100 plus your VAT. So it'll be $95.20 plus VAT. And then over 100 employees, you get a 25% discount. And you pay $89.25 plus VAT per employee. So it's a pretty good discount, whether you're a small business or a relatively larger business. You get a discount off of the plan per individual.
How can they pay?
So payment can be made in one of 4 ways. You can pay online through our payment portal.
Mhm.
So this is relatively easy. All you would need to do is input your information, your account number, which will be sent once you reach that step in your enrollment, as well as the amount that you're paying. And once
Mhm.
you submit that, we receive that payment right away.
Okay.
Payment can also be made in person at any of the doctor's hospital locations. You can let them know that you're paying for your LAMP membership. They receive your payment and then it's applied to your account once we receive notification that you would have paid. You can also pay via wire transfer. So that
Mhm.
information is also sent once you reach that point in your enrollment where you're ready to pay. And then we also have payment authorizations where you would place your payment method on file and we deduct in the frequency you're choosing. So right now we have monthly deductions, quarterly deductions, and yearly deductions. And we do encourage persons to use the payment authorization method as it's most convenient, as we do have persons who sometimes forget to pay at the end of the month or at the end of the quarter, due to many things. So you pay most of your bills at the end of the month. So sometimes
Right.
you forget or something may have happened. So we realize that persons who are on the payment authorization, they don't have to worry about, okay, I have to pay my LAMP.
Mhm.
Like we do all of that for you. So we do encourage persons to, if you're interested and you want to sign up and pay and everything, definitely sign up for the payment authorization so that we can worry about your deductions and you don't have to worry about paying every month or every quarter or anything like that.
Payment option, please. Automatic.
Yeah,
Take it out,
automatic
take it
deduction.
out,
Yeah,
take
I
it
don't
out
gotta
right
worry
away.
about it. Yeah.
I don't want to see it.
Mhm, mhm.
Just take it out.
Mhm.
Take it out.
Take it out.
When I show up, it's no problem.
At least and I'm covered.
Yes.
Yes.
Mercedes, can you tell how does LAMP actually address the healthcare needs of small businesses or organizations looking to provide coverage for their employees? Because I know that this is something that you're starting up your business. Health insurance may be a little bit out of reach.
Pricey, yeah.
Mhm.
How do we address that?
So, we provide some form of coverage. That is
Better than
exactly what we
nothing.
do. Because a lot of small businesses, they aren't able to provide health insurance. For a number of reasons, just starting up.
Yes,
The
yeah.
cost of covering several people can be expensive. So we provide we made plans. I don't know if Laniqua touched on that. So we have small biz plans for businesses
Mm.
and they're discounted. So we have we have a 5 to 10 employee.
Mhm.
We have a 5% discount. So
Okay.
each employee will pay 113
Right.
and 5 cents. Yeah.
Okay.
11 to 25, we have a 10% discount, and so on and so on. The
Mhm.
more employees, the bigger the
The
discount.
bigger the discount,
Yeah.
right?
So we try to facilitate that to say, hey, we want to offer every business wants to offer their employees benefits.
Mhm.
That's we have benefits,
Mhm.
come work for us. We
Mhm.
give you X, Y, and Z. But if you can't offer someone benefits, it's kind of like, so we're here to say, okay, you can offer a healthcare,
Something.
you can offer something, a healthcare membership to your employees, until you're able to maybe facilitate a full comprehensive
Plan, yeah.
insurance plan,
And I know that, so again, we just spoke about, you just literally 2
Mhm.
seconds ago spoke
Mhm.
about how it can be difficult to pay for insurance and healthcare. So a plan like LAMP is essential for promoting, why is this particular plan essential for promoting wellness and preventing financial strain and to accessing healthcare in the Bahamas? I think um, you had said that there's a lot of preventative benefits
Yeah.
that you can enlist and
Mhm.
use within this plan, but why is it important?
Yeah. Because like you said earlier, you was touching on the healthcare crisis, in
Mhm.
the Bahamas. Our culture is we like to eat, we like to have a good time, but we don't like to take care of ourselves sometimes. And not even sometimes because we don't want to, it's because we can't afford
Can't afford
to.
it.
Yes.
And being in a expensive living in a country like the Bahamas, it's expensive
Yeah.
to get good healthcare, high quality healthcare
Mhm.
that comes with you got to break your bank.
Yes.
So you have your middle class and your high class individuals, they maybe can afford it. But then we have the majority of our population who, they're just trying to make ends
Make
meet.
ends meet,
Mhm.
right?
And it's a huge gap, and it's not fair that those people are developing so many different illnesses that could have been prevented just by
Yeah.
having an annual
Just to
or-
check in.
Yeah, just to check in or just seeing their doctor more frequent that within that year.
Mhm.
So it is just very important, just so people can have something to say. Hey, I can just go and see my doctor. It's already paid for $119 plus VAT per month. I mean, come on. If something happened, I know me, like when I have to go to walk-in clinic, I'm like, oh my God. You know what I mean? Like I did not plan for this, but you already pre-plan because you're paying your monthly membership and it's
Yes.
covered.
Yeah.
You know what I mean? So you don't have to even worry about that stress, So and I think it's gonna uplift the community in a positive way. It's
Yeah.
gonna add.
I think when we think about making our contribution, and I think this will also expands, even though this is something that we hope to profit from, but I think as we provide solutions for people to access
Yeah.
quality healthcare,
Mhm.
I think this definitely plays a part,
Yeah.
and it's an amazing initiative.
Yeah,
Yeah.
it is.
Yeah.
Yeah.
Mercedes,
Yes.
thank you so much.
Thank you,
Let me just remind you
Eddie.
of her position. She's the Client Services and Reconciliations
Oh,
Officer. So
mhm.
she'll probably will be on the phone
Yeah.
if you ever call to find
Mhm.
out whether or not you qualify.
Mm.
And Laniqua Sands, thank you so much again.
No
She is the Membership
problem.
and Collections Officer within the LAMP program. The Ladies of LAMP, the LAMP ladies.
The lamp ladies.
The LAMP ladies. LLs. Thank you so much for your insight. Is there anything
Thank
that you would
you,
like to
Eddie.
add? Any contact information that you would need that you can give our listeners?
Yes. So, like I would have previously mentioned, we can be reached at 822-1009, or you can call 302-4635. You can also reach us by our LAMP email. It's lamp@doctorshosp.com.
All right, that's HOSP.
HOSP.
HOSP, not shop.
HOSP. Yeah.
Ladies, thank you so much for
You're
joining me
welcome.
today.
Thank you for having us.
You're welcome. On behalf of my producer, Gally, thank you so much for listening to the Doctors Hospital podcast. And remember, at Doctors Hospital, we care by providing the best care now.
Experience the Bahamas' top provider of physical, occupational, and speech therapy services at Doctors Hospital Rehab Center. Visit one of our 2 JCI accredited facilities, where we offer optimal patient safety and quality care for your healing journey. Let us rebuild and restore your health, mind, and spirit in a supportive environment with specially curated massage and exercise therapy services for newborns to senior adults. Doctors Hospital Rehab, where your wellness is our priority. Schedule an appointment at 302-4626 or 805-1204.